Hi everyone, Dr. Jeff here with you again this week. We're continuing our talks on foot and foot issues. Today we're going to talk about metatarsalgia, and I'm going to be using Hannah, our foot model, with us today, and we'll be looking at her foot. So hi everyone, we've got foot model Hannah with us here today, and we're talking metatarsalgia. Metatarsalgia is a foot issue. It can be quite painful in your foot. Usually it occurs just below your toes here. Some people describe it like they're walking with a pebble in their shoe, and it can be quite a sharp pain. Generally what happens is when people are walking, their toes should bend here. But if you're not walking properly with poor foot mechanics, it can bend a little further back. When that happens, the bone running down here gets pushed down and can drop down into the bottom of the foot, and that causes an irritation. Some people actually get calluses or are very red at the bottom of the foot where it's rubbing against your shoe. People that are more prone to this are people with a high arch or a flat foot, so poor foot mechanics. They can have a little bit of bunions. That's what, again, we talked about last week, where that big toe turns in. You get some rubbing in there. Also, people with a second toe longer than their first toe, like Hannah has here, they're more prone to getting this. Also, this time of year we get a little more. We see a little more of this because generally people have gone south. They're walking in sand. They're walking in flip-flops, and that causes improper foot mechanics and can cause this type problem. So what can we do about that? Well, one thing we do here is, as a chiropractor, is we can get in there, we can adjust it. So we're actually going to get in there. We're going to pop that metatarsal head back up again. There's a number of ways we can kind of get at that and do that. We can also do laser, and we can do some ultrasound on it. One thing I find useful too is I'll take a little corn pad here, and I'll put it on the foot just below where that metatarsal is, and that kind of pushes up on the toes and gives it a little bit of cushioning and supports that metatarsal head. What you can do at home with this is, you can use a golf ball. You can roll it with a golf ball, roll it with a frozen water bottle. You can put some anti-inflammatory cream on it. You can take some ibuprofen, things like that. If it's something that's a chronic issue where people are getting it over and over again, we can get an orthotic. In an orthotic, we put a little bump in here called a metatarsal pad. And again, that just supports the metatarsal, keeps it up, and gives some cushioning to the metatarsal. One problem we have with this, if it's not taken care of promptly, you can get something called a Morton's neuroma, and that's where the nerves coming down through the foot here can get impinged. Usually happens between the third and fourth toe, and that can cause some numbness and tingling in the foot, and also be quite bothersome. So if you think you're suffering from metatarsalgia, or you have an issue with your foot, you can come in and we can certainly take care of that for you. It's not that hard to fix generally. If you have any questions about anything we talked about today about metatarsalgia, you can always email me at jgoldsworthy@goldswillis.com, or you can talk to me on Facebook. If you have any other questions you want to send my way, I can certainly research them for you and answer them for you. And as always, I'm here with foot model Hannah and Dr. Jeff, and we've got your back.